I was in philanthropy. So you really are building a path towards where you want to be. You may actually start out somewhere else. I'll leave you with that.
People have heard about me. Okay, I'm Gene Falk. I am the co-founder and CEO, whatever title we're using, this week of Mothers to Mothers. I said I didn't know stuff about Lakshmi that she has just revealed to all of us, including her nerd background. I always thought she was cool. She was our program officer at Skoll. For those of you who don't know Skoll, you should, if you're really interested in social enterprise, you should find out about Skoll because they think about it about as well as anybody I have encountered from many different angles. And one of the things Lakshmi mentioned, just sort of in passing, was the notion of generalists and people not knowing what to do with people coming from different backgrounds. And I think that one of the things I love about Skoll is that they seem to appreciate the notion of generalists and the notion of applying different skills to the challenges that social enterprises actually tackle. So and when I used to run into Lakshmi, I would actually bow, usually kiss her ring or her feet or one of those things, because as program officer, she's in charge of making sure that we get the next tranche funding. So now that she has come over to our side, I get to just greet her and be nice to her because I want to, instead of being nice to her. Over effusively nice to her. Anyway, little background, trying to I also got off a plane yesterday from South Africa, which is 18 hours and many time zones, so I'm trying to keep myself going here too. Question, audience, let's see, I'm curious who's in the room. Do you mind a show of hands of people who are either students currently or sort of recently, last couple of years, out of school one way or another? Bulk of you. I don't have another category. Interested people who are coming who are interested, and thank you all for taking the time. Okay, background. How do you get here? What do you do? I have absolutely no good answers, as you'll see when I trace my history, except for the fact that the thing that does follow through is do what you know and do what you're good at and apply that to whatever you do. I think that's very well put, and inadvertently what many of us have learned. Mothers to Mothers, in sort of the elevator version of the explanation, is we work with women, HIV positive pregnant women and new mothers to prevent the transmission of HIV from the mothers to the babies. How we do that, long story. Short version is we had this idea of doing something that we thought was very simple but completely missed in the process of PMTCT, prevention of mother-to-child transmission, and started an organization to do that because we thought it was a gap that should be filled, and we had a vision that it could be filled in more places than the handful of locations we were actually physically in Cape Town, South Africa at the time. And now, 10 years later, but sort of really we sort of look at it, our first 5 years was moving the needle a little bit with a lot of ambition, and the last 5 years we've grown significantly. We've gone from a handful of sites in the Cape Town area to a number of sites in various parts of South Africa, to now we're in 700 locations in 9 sub-Saharan African countries. And our program actually reaches 20% of the HIV positive pregnant women in the world. I used to have hair and look a lot less tired. We also employ, in order to do this, we employ 1,800 HIV positive new mothers on a full-time basis, employ, pay, train. That's our model. So how did I get there, and what does this all mean? Let's see, it's an interesting story, and the question is where to start. let's see, I went to Williams as an undergrad. I was an English major. I graduated in the middle of a recession and wound up, after trying to find various kinds of jobs, because I didn't have a 5-year plan. I barely had a 1-year plan, but I wound up running the college bar, which is what you do with an English major, I guess. Although I say that completely joking. There are many times, and subsequently in interviews, where people would look at me and say, English major. And I was like, actually, I thought it was pretty good preparation for a lot of problem solving that came down the road. That's another story. So ran a bar, went back and got an MBA. Had no interest in doing that. When I say no 5-year plan, when I started running the bar, I wouldn't have thought that I was going to go to business school, but I did. And I had, part of my undergrad studies was theater, and so I thought I'd go into the entertainment industry, which was my excuse for getting another degree. Happens in Jewish households also. You need something, get another education. I did, and I wound up working for HBO and then for Showtime, and long story short, I spent 20 plus years working in the entertainment industry, doing a lot of really fun stuff. Mostly after the first half of that, I was working in new businesses within these larger corporations, at the point where technology and content barely overlapped, and our job was always to make the business out of what wasn't yet a business, so you were making it up as you went along, which is really, really, really good training for social entrepreneurship or any kind of entrepreneurship. It is entrepreneurship within a large organization. So that's what I was doing, and it ranged from early internet, TV applications, and I can, if I weren't jet lagged, I could drop the cool technical terms that have evaded me, having lived in Africa for now 7 years. But the point is that did a lot of really fun things. We had a partnership with the boxing promoter Don King when I was working on pay-per-view, and that was a kick in its own right. Yeah, I could tell lots of, those are different stories, but the point is, it was a checkered career, but I wound up running some huge divisions of some of these organizations and starting large new businesses, and so I'm making fun of it, but it was fun, and it's fun to make fun of the fact if you work in television, on one hand you say, well, we're certainly not doing any damage, and on the other hand you say, and let's not take ourselves all too seriously. So it was great. It was really quite a wonderful ride. And then in 2000, about 10 years ago, I went to visit this is where fate and college come into play. I went to visit my college roommate, who was still one of my best friends. I was his kid's godfather, and etc. He was an American doctor who had relocated to Cape Town with his family, and he was doing clinical work. He was an OBGYN, and it was just at the point where the meds to prevent mother-to-child transmission were first available in South Africa. Yeah, that was the beginning of the end. But there's a little bit more to that story. What happened was, while I was working at Viacom, and HBO, and Time Warner, and all those places, I was also very involved with AIDS work, HIV work, gay and lesbian rights. I was with a number of organizations that were involved in those battles through the 90s, and at points when things were neither as remediable as they seem today, nor some of the issues that are being dealt with didn't even seem like they would ever be on the radar. And the point was, it was a struggle, and but particularly in terms of HIV and AIDS, it was a struggle that the community essentially picked up and embraced and changed the way healthcare was delivered, regulated, administered in the US. And that was something that I knew and had been involved with as a strategist, as a fundraiser, as a board member of a number of organizations. I went down to visit Mitch in Cape Town, and he took me out to the places he was working. And his experience as a doctor was that he would see a young woman and say to her, you are pregnant, you have a healthy baby on the way, did you know you have HIV? And then he might never see her again. He said, you have HIV, I can help. She heard, I have AIDS, I'm gonna die, my baby's gonna die. And it's that simple. And so, also very simply, what he did was start asking some of his patients who did stay through treatment to come back and help him and talk to the women so that he wasn't the only one who they heard from when he had to give them this news. And that was Mothers to Mothers. First time I visited was about 3 months after Mitch had done that, and he had this idea that he knew the stats and he knew that PMTCT was not succeeding, even though technically it was a very simple intervention, and he thought it could happen all over the world. And I went with him and saw one of his clinics, and to tie things back, what hit me was how very much like it was in the US, particularly in the gay community, in the late 80s, early 90s, except the difference is the gay community was basically a middle-class community. And once we all stopped worrying about what are people going to think if we out ourselves, it was like that in the old days. Are we going to lose our jobs? It truly was like that in the old days. We had clout. There was money, there was the ability to organize, there was the ability to put together community organizations, and many of my friends survived that as a result of the fact that the community organizations that we put together helped them through and saved their lives. And I was looking at what was going on in the townships of South Africa, and the difference was that the women there were equally marginalized. But they had absolutely no ability to put together an organization. They had the individual ability to help each other and support each other, but they didn't have the money, they didn't have the political clout, they didn't have the skill to organize. And so Mitch's notion was very simple, which is take something that happens all the time, a woman talking to another woman, take something that's always done sort of informally and voluntarily, which is peer support, and scale it, and create a way where you can do it everywhere that treatment is happening, so that no one slips through the cracks because she's too scared or too stigmatized to accept treatment. And I said, not only do I recognize this because of the involvement I had as a volunteer, I knew the people who headed the organizations in the States, some of them where there was money, so I went back and started helping Mitch, and I founded the US, put together a board in the US, started raising money, etc. Long story short, about 18 months later, I thought, great time, it's winter in New York, I think I'll go to Cape Town. In fact, the opportunity to spend a long vacation between Christmas and it's supposed to be 6 weeks. And that stretched into about 6 months. And that was 7.5 years, 8 years ago. And I'm still there. And we've grown the organization. We shared the vision that you could take this very simple idea and by applying some very simple principles of how do you do these things, how do you